We are here now in the OR room, I should say, at Beechwood Plastic Surgery, and Dr. Goldman joined me once again. I feel like this is a room that can be intimidating for patients at first because they sometimes get nervous to have surgery. So what would you say are the questions that patients need to be asking about the setting, the doctor?
Okay, the number one question is the facility accredited? So actually legally in most states, including Ohio, it has to be accredited by certain organizations that have inspected the facility, made sure they have all the resuscitation equipment, update technology. So number one, is it accredited, and even by whom? Number two, how often do you do this kind of surgery? What other procedures are done there? How many days a week is there surgery going on in that facility? Number three, who's providing anesthesia, right? How are they qualified? So in many settings, nurse anesthetists can do it. In most settings, especially hospitals, anesthesiologists will do it, but each may be appropriate in the right setting as long as they're well qualified and experienced. And then other things like, how long is recovery? How do you recover? Things like that, that basically once patients start asking some specific questions, they'll very quickly get a sense of,
Sure.
are the answers legitimate? Is the place a good place to be?
Now, speaking of, we're walking into, I know you mentioned recovery. This is the recovery room area?
Yep, so one nice thing about a facility like this, which is highly focused on cosmetic surgery, is that instead of going down long hallways on their way to an intensive care unit, you go right from an operating room to a recovery area. Right, so the shorter that trip, the safer that trip is, because you go from one monitored setting to another monitored setting. Once you're in that setting, it depends on how people do specific things, like what medications are given during recovery. Is somebody given enough pain medicine to control pain, but not too much to keep them sleepy and make them nauseous? So all these things are geared toward the specific procedures that one does and one has, right? And so you want to tailor it, because something like a rhinoplasty actually won't require that much pain medicine after surgery. So patients can wake up quickly with less nausea. Something that's like a breast augmentation usually takes less than an hour of surgical time. So that person should wake up from the anesthetic pretty quickly. And then it's a question of, are they comfortable? Are they starting to move around? And you have to have specific parameters that you look at, not just in surgery, but in recovery, to keep everything safe, because safety is the key.
Safety is always the key. I was talking with their staff, and they mentioned that a lot of people come in and ask the question of, can I do a couple of things at one time here? Say they want to get a breast augmentation and rhinoplasty. Can they do things at the same time?
Right, so it's perfectly safe to combine procedures when those procedures are of an appropriate duration. So for instance, a mommy makeover is some kind of breast surgery, reduction, augmentation with a tummy tuck. Right? And we usually do that with liposuction. So those procedures are commonly combined. But you might combine a facelift with eyelid surgery, with a laser, and we do some lasering on the other side, awake, and we do some lasering under anesthesia, asleep, depending on how intense and deep it is. So it's safe to combine them, but you also have to make sure that patient is young and healthy, and even if they're older, are they active and healthy, and have they had medical clearance to make sure that it's okay not to just do little cases, but to do longer cases too.
Well, there's so much, again, under one roof here, and one of the best things about it is the door to leave once you're done with surgery is literally right there. You walk out, you get in your car, you go home to recoup.
Right, so little things like not going through a big hallway, having a bunch of people watching somebody, just going right out to your car. It's a little thing, but those kinds of things add up.
And if you have any other questions, again, this is Dr. Goldman's office here. Beechwood Plastic Surgery here on the west, or on the east side, I should say, in Beechwood, and then you have your other location also in Westlake as well.
Everything but surgery in Westlake, right? So here we focus, you want to be comprehensive, but you want to keep it safe. So surgery just here.
Well, thank you so much for joining us today.
Thanks as always,
I
Natalie.
hope you enjoy this as well.